Good afternoon, dear respected attendees. My name is Sarah Said Hassanein. I am a teaching and research assistant at Zoology Department, Faculty of Science, Cairo University, Egypt. Currently, I am a master's student at Egypt Japan University of Science and Technology, Alexandria, Egypt. It's a pleasure to present today in the International Conference on Recent Advances in Medical and Health Sciences, our research article. I'm interested in investigating gene expression level in lung cancer, molecular mechanism of lung cancer cell behavior, and the association of computed tomography image features with lung cancer biomarkers level. Today, I will present our data for the research article entitled "Downregulation of EGFR messenger RNA might light a candle in small cell lung cancer cell diagnosis." Firstly, I will give a brief background about lung cancer. Lung cancer is the most lethal cancer type among both sexes worldwide. Histologically, it is divided into two different subtypes. Non-small cell lung cancer accounts for 85%, and small cell lung cancer account for 15% of lung cancer incidence. In lung cancer diagnosis, the computed tomography has been broadly used. However, more than 60% of lung cancer patients are usually diagnosed at late stages, stage 3 or 4. Other limitations have raised significant concerns, probable risk including overdiagnosis due to high false positive rates, unnecessary radiation exposure, patient anxiety, and economic burden due to its high cost. Besides, the substantial development in lung cancer tumor biology have led to the detection of therapy based on the tumor molecular features and the clinical pathological condition of lung cancer patients. Unfortunately, the 5-year survival rate for non-small cell lung cancer is 25% compared to the 7% of small cell lung cancer. Despite the high mortality rate of small cell lung cancer, the molecular diagnosis for this lethal cancer has been underestimated. Interestingly, one of the molecular markers is the epidermal growth factor receptor, a transmembrane protein receptor, which belongs to tyrosine kinase of the ERBs family. The signaling pathway of EGFR activate many intra-signaling cascade linked with the low survival rate and the persistent metastasis of lymph node and the poor chemosensitivity in lung cancer. It is well known that the EGFR messenger RNA is frequently upregulated in non-small cell lung cancer. However, its expression in small cell lung cancer remains elusive. Our current study aimed to quantify the level of EGFR messenger RNA in small cell lung cancer tissue and their matched non-neoplastic tissue in order to provide a better diagnosis for small cell lung cancer patients. The patient demographic and clinical variables were obtained. We recruited small cell lung cancer patients after obtaining the ethical approval and an fully informed written consent before sample collection. Patients who were pre-operatively diagnosed without neoadjuvant therapy were included, while those who had definite surgery and/or adjuvant therapy or clinical complications were excluded. The tissue biopsies were preserved in RNA later at minus 20 degrees Celsius till use. The clinical pathological data of small cell lung cancer patients were obtained. 10 patients were diagnosed as small cell lung cancer, 4 of them with limited stage, and 6 with extensive stage. They were male and aged from 42 to 74 years old. 8 of them were smokers, 1 heavy smoker, and 1 non-smoker. The bronchoscopy observation include compression of lung cancer wall appearance, obstruction in left or right lung, presence of small masses, presence of multiple nodules, and the ease of bleeding open the bronchoscopy touch. The computed tomography observation of small cell lung cancer patients. A. Right or left lung masses respectively. B. Presence of pleural effusion. C. Limited stage disease of small cell lung cancer where tumor is limited to one side of lungs, left or right. Extensive stage disease small cell lung cancer where the tumor is gross in both lung sides with or without the pleural effusion. We have determined the EGFR messenger RNA level in carcinoma tissue and their corresponding non-neoplastic tissues for small cell lung cancer patients. Number of patients were 10. The quantitative real-time PCR results reveals that a significant downregulation of EGFR messenger RNA expression in small cell lung cancer tissues as compared to the non-neoplastic lung tissues, with a p-value less than 0.001. Also, we have determined the value, the diagnostic value of EGFR messenger RNA, and the receiver operating characteristic curve indicates that EGFR messenger RNA had a diagnostic accuracy with an area under curve of 0.93. This study marks that the downregulation of EGFR messenger RNA has a potential diagnostic marker in small cell lung cancer patients. Further studies are needed to verify EGFR messenger RNA and the protein expression level, but in a larger number of small cell lung cancer patients. There are many challenges for for the lung cancer diagnosis. In Egypt, the limited diagnostic tool render most lung cancer patients diagnosed at late or advanced stage with poor prognosis. A challenge due to the economic number of advanced lung cancer patients. We do give our special thanks to ITDA Collaborative Research for funding this work. Also, we do acknowledge the Cellular and Molecular Bioscience Research Laboratory, Zoology Department, Faculty of Science, Cairo University, Egypt, at which a part of this work was conducted. This study was also financially supported by the Ministry of Higher Education, Egypt, and I am the recipient of a research scholarship to obtain my master's degree. The authors also wish to thank the pathologist Dr. Shadi Elia, Associate Professor at the Department of Pathology, Cairo University, for assisting us in the histopathologic examination. Thank you for your attention.
Thank you. It was a wonderful presentation.